When a person makes the decision to go on Medicare, they can use their Medicare benefits in two different ways. I call these systems. And when you go on Medicare, you cannot be on both of these systems. It has to be one or the other, so you have to choose. One way to use your Medicare is to stay in original Medicare A and B, where Medicare is the first payer, and get a supplemental plan to fill in the gaps that Medicare did not cover. So that's one system, A and B with the supplemental plan. The other one is to replace original Medicare A and B with an Advantage plan. These are also called C plans. And so this is a private health insurance company that has replaced original Medicare for you. And so these are your two options. There are differences between these. And so that's what I'm going to do in this video. I'm going to show you the one thing they have in common and then the 7 things that are actually different between these two systems. So these two systems had one and only one item that is going to be the same, and that's this. We've got to be enrolled in Medicare A and B. Now, for most people, Part A has no premium, but B has a premium. This year, that's $170.10 every month. If you're on Social Security, and that comes out of your check. If you're not, they're going to bill you for that on a quarterly basis. So point is, if I'm on a supplemental plan, I'm enrolled in A and B. If I'm on an Advantage plan, I'm enrolled in A and B, and I'm going to have to pay that monthly Part B premium. Now let's talk about the 7 differences. All right, so difference number 1 between these two systems is out-of-pocket expenses. Out-of-pocket expenses. So let's look first of all, if we go with the supplemental plan, what are we doing? Well, we're going to have to pay our Medicare Part B premium, $170.10 a month, and then we're going to have a plan. And right now, and I'm just going to use this example, most people get a G plan. The G plans are going to vary in price around the country, but on the average right now, that's going to be somewhere between about $125 to maybe $150 on a monthly basis, okay? And so we've got a monthly premium. In addition to that, we also have to have a Part D plan. This would be your RX coverage. And again, there's usually 15 to 25 different plans in every zip code. But right now, those plans range anywhere from about $7 on average to maybe about $30 a month. Now, there are certainly some plans that are higher than $30, but most people are going to be in that $20 to $30 range. But you can see what's happening in this option. Our out-of-pocket expenses is we're going to have to pay our Medicare B premium, $170.10. We got our G premium, whatever that's going to be, and our drug plan. So you can kind of see in this option right here, this is going to cost us, what would that be on the low side? Somewhere around $310, maybe on the high side, maybe $350 on a monthly basis. But what has happened by paying these premiums is we've taken the liability of our healthcare expenses and we transferred that to an insurance company. So in this scenario here with a supplemental plan, I'm out of pocket my B premium, my supplemental premium, my drug plan, but medically, only thing I have to meet is a B deductible. B deductible. This year, that's once a year, $233, okay? I don't have any other deductibles. I don't have any copays. I don't have any coinsurance. I don't have to pay excess charges. So all those expenses are transferred to the insurance company. And so once a year, I need to meet my B deductible and everything else is taken care of. And that's why I had to pay those premiums. Now, with my drug plan, I will certainly have some copays and maybe a deductible, but medically, I've got rid of all of that liability. So the way I pay for that supplemental plan is going to be different than my out-of-pocket expenses on an Advantage plan. So now let's look at the Advantage plan. If you decide to go with that, how are you going to pay for that? Well, the Advantage plan, the way it works, most of them have a 0 premium. Now, there are some that have, maybe a low premium, but most of them are 0 premium. And why is that? Well, the way we pay for Advantage plans are copays, right? And so we're going to have copays. We're going to have coinsurance on some services such as chemotherapy and different items. And sometimes we're going to have some small deductibles. Again, no premium on a monthly basis, but we pay as we go. And so that is the difference. If I have a supplemental plan, I pay a premium and I don't pay as I go because I've kind of prepaid and for them to take my healthcare liability from me. But here, I'm going to pay as I go. So if I go to the hospital, I have a $350 a day copay. I have an outpatient procedure, an outpatient surgery, probably $250. Have an MRI, maybe $200 for the MRI. See a specialist, maybe $50, but it's a pay-as-you-go system. So with supplemental plans, we pay a premium and very little after that. With Advantage plans, very little premium or nothing, but we pay as we go until we hit what is called the max out-of-pocket. and that max out-of-pocket is the annual amount that you would pay through your copays, and it's usually somewhere between about $3,500 a year upwards to maybe $10,000. So difference number one, our out-of-pocket expenses will definitely be different. Hey everyone, just real quick. We're trying hard to get this content to more people just like you who are looking for honest and helpful Medicare answers. So if this video has been helpful, you can help us out by hitting the like button and subscribing. Now, you could try signing up for Medicare alone. I wouldn't recommend it. But if you want free Medicare help from a Medicare expert, check out the links in the description. We literally help thousands of people every month make Medicare decisions. All right, let's get back to the video. All right, that takes us to the second difference between Advantage and supplemental plans. What happens if I go with the supplemental plan, basically your network is Medicare, which means that any provider that takes Medicare, you can go wherever you want. So every hospital takes Medicare, and most doctors are going to take Medicare. So you don't have to worry about HMOs or PPOs because when it comes to a supplemental plan, as long as those people will take A and B of Medicare, they will take your supplemental of choice. In fact, they're obligated to do so. So they can't say, well, we're not going to take that supplemental plan. That never happens. If they take original Medicare, they will take your supplemental plan of choice, whatever company you choose, and whatever letter of a plan you choose as well. All right. But when it comes to Advantage plans, what's going to happen is Advantage plans will either have an HMO network or a PPO network. So you can't just go anywhere that you want. You have to, when you select this option, you got to make sure that the providers that you want to go to, be that a primary care doctor, a specialist, a hospital, is going to be in that network. I will tell you that HMO networks are usually smaller than PPOs. There's less providers within HMO networks than PPO, and the reason for that is because those Advantage companies don't pay the HMO providers as much as they would a PPO provider. And there's some providers that just simply say, we're not going to see patients for that little money, and they may enroll in the PPO plan or they may enroll in neither of the plans. Totally voluntary. Okay, so there's a difference. Supplemental plans go anywhere you want as long as they take Medicare. Advantage plans, HMO or PPO, and you have to make sure that your provider is going to be in that particular network. And then that takes us to the third difference, and that has to do with Part D plans. Part D plans. So again, if you take a supplemental plan, what's going to happen is you are going to have a Part D plan that we actually call these stand-alone plans, or you could just say these are separate drug plans. Okay, so what we have in this scenario is I have A and B. I add my supplemental plan. We'll just call it a G plan or an N plan or an F plan, whatever you add, and then we add a drug plan. And each of those parts of my plan are going to have a separate premium. Now, one of the benefits of the standalone plan is that in most markets, we're going to have anywhere from 15 to 25 plans, and you get to pick your plan. You get to choose the plan based upon the medications that you are taking and the pharmacy that you would like to use. And then if you're unhappy with that plan going into the next year, October 15th to December 7th, you can actually change that drug plan. So maybe next year you're taking more meds or less meds, and so you can change your drug plan. There's no problem to do that during Medicare's open enrollment period because we have this standalone drug plan. All right, now let's say if we have an Advantage plan. We have this Advantage plan. What's going to happen for my Part D? It is going to be included. We also use the terminology embedded. Those are synonymous, but it just simply means that what that Advantage plan is going to do, it's going to cover you inpatient and outpatient. That's the Medicare Advantage, but now we have a prescription drug plan that's also a part of that. So they embed it, they include it. Now, negative here is you don't get to pick it, but that's not a big deal as long as you check out that prescription drug component of that Advantage plan to make sure that your medications are well covered. All right, so we always tell people on Advantage plans, make sure our docs are in network, hospitals in network. We're happy with the copays. We're happy with those things with the plan, but we're also making sure that we're happy with the drug component as well. All right, because here we don't get to pick and choose. They pick and choose what plan that I will have for the prescription medications. All right, so that certainly is a difference. And then that takes us to number 4 difference between SUPs and Advantage, and that is this item here called a pre-authorization. Pre-authorization. Now, what a pre-authorization is, it's some type of a healthcare service that must be pre-approved before you actually receive the healthcare service. So the doctor says this is what you need. You need lab, you need a CAT scan, an MRI, you need a hospital stay, you need an outpatient procedure, outpatient surgery, but it's some type of a service where it must be approved prior to you getting the service. Okay, so if someone stays in original Medicare A and B, and they get a supplemental plan, and again, I'm just using for this example, supplemental plan G, but if they get that F plan, that G plan, or that N plan, whatever they get, what happens is there are no pre-authorizations whatsoever, which means your doctor and you and Medicare are making all the decisions. No insurance company has any say-so because those supplemental plans cannot deny the coverage. If Medicare says you need this and we're going to cover it, and doctor says you do qualify for this service, then end of story. You're going to get that particular test or procedure or scan. It's done. That insurance company has no say-so because if Medicare pays, then that supplemental plan is going to follow, filling in the gaps based upon the letter of the supplemental plan that you purchased. All right. So the point is no pre-authorizations when you have supplemental plans. It is your doctor or Medicare and you that are going to make all the decisions. Not so when we have an Advantage plan. Advantage plans are going to have pre-authorizations, okay? They will have pre-authorizations, yes. They tell us right now, right around 72% of all services that you need on the Advantage plan are going to have to be pre-approved. So the doctor says you need it, and you believe, you do need it, but the decision, final decision, is going to come from the Advantage plan because that doctor's office or that hospital or that specialist is going to have to reach out to that Advantage plan and get that approved before you get the service because you have to make sure the Advantage plan is going to pay for it. And so there's a process, this pre-approval process. And so there are some times when I've seen people have to wait for 3 to 6 weeks before we got an MRI approval. The process took that much time. We've had people that needed a hip replacement and the Advantage plan did not agree. They believed you just simply need therapy or maybe a rod inserted instead of a full hip replacement. But that's what happens sometimes with Advantage plans. And it doesn't mean they don't care about you and they're not going to give you adequate service. It just simply means that they get to have the final say-so. It's not your doctor and you, it is that Advantage plan that has the final say-so. Okay, and so you have to live with that particular restriction if indeed you take an Advantage plan. We have a supplemental plan, we don't have to worry about that. So again, that's difference number 4. And then that takes us to difference number 5. And this has to do with perks. Perks are just add-on benefits that insurance companies can make available. So if we stay, again, in original Medicare A and B, and we get a supplemental plan, whatever letter of plan you buy, as a general rule, there really will be no perks. Now, I will tell you there's a couple companies that offer a gym membership and 24/7 nurse line and maybe some kind of a dental discount plan. So some of them will have just a limited perks. But as a general rule, supplemental plans don't have perks. They have very good insurance, but no perks. But when it comes to an Advantage plan, these are the ones that have lots of perks. The perks on Advantage plans vary, but as a general rule, we're going to have some kind of a dental benefit, a vision benefit, some type of a hearing aid benefit, almost always a gym membership benefit. Go to certain healthcare facilities at no cost. They'll give you an over-the-counter card and load it every quarter with usually $30 or $50 a quarter that you can get over-the-counter items through the plan. And then sometimes you'll have a plan that actually have what we call a Part B reduction. And they actually, instead of you paying full price for your Part B, $170.10 that it is this year, they may give you a $50 credit. So your Social Security check increases or your bill for Part B is going to be reduced by that amount of money. Not all plans have it. Certainly not everyone qualifies for it, but the point is that is one of the perks that is often advertised. Okay, and so again, supplemental plans, pretty much pure insurance, Medicare Advantage plans, good insurance, and then lots of perks. All right, so there's a distinction between those two. And then that takes us to difference number 6. Okay, and this would be policy term. Policy term. In other words, how long do I have that policy? Well, again, if we get an A and B plan with a supplemental plan, what's going to happen? Well, that supplemental plan is actually a lifetime policy. once you've been approved, that insurance company can never cancel that coverage, except for non-payment of a premium. They can certainly cancel then. And let me just cover that while we're at it. As long as you pay your premium, that policy is for life. If you remiss a premium, what they do is give you about 30 days of grace to bring it current. And if you haven't brought it current within that 30-day grace period, they absolutely will cancel a supplemental policy. That's the only reason they can cancel it. They can never cancel it because of health problems, health changes, maybe lots of health issues you have going on, and they're having to pay a lot of money out in claims, so they never can do it because of claims. They can never do it because of age. You could be 110 years old, and they can't cancel that policy. And they also can't do it because of location. In other words, when it comes to a supplemental plan, they're totally portable. When you're on that supplemental plan, it is written for life. And so if you happen to relocate, let's say from Dallas, Texas, and move to Denver, Colorado, or you're in Kansas City and you move to Chicago, Illinois, you can take those supplemental plans with you because they're totally portable. They can never cancel your policy because you relocated, because it's tied to you and it's the same coverage anywhere in the country. So it's a lifetime policy, totally portable. Now, as we compare that to Advantage plans, that's not the case. Advantage plans, what's going to happen is this. They are not tied really to you so much as they are to a service area, okay? And they're only good for 1 calendar year, okay? That's it, 1 calendar year. So when someone enrolls into an Advantage plan, it's an agreement between 3 parties, Medicare, the Advantage company, and you. But it's only for 1 year. And that's why we have every year this open enrollment period, October 15th through December the 7th, where you can switch plans with no medical underwriting required. Why is that? Well, because the government, Medicare, tells the Advantage plans if they want to change any component of that Advantage plan from year to year, they can do so. They can add a premium. They can change the network. There's a lot of things, so they're very fluid agreements. And that's why you as the consumer can switch your plan during the open enrollment season, but it's only 1 year. They're also not portable. Why? Because it's tied to what we call a service area, which is typically a metro area. And that means that if I leave that metro area and go to another one, let's say if I'm in Denver, Colorado, and I just move to Dallas, Texas, well, those plans are going to be different in those 2 cities because we've changed service areas. And so we have this provision called a mover, and we can actually move you from one Advantage plan to another if indeed you have relocated. So you don't take them with you. You have to go get a different plan, a different network, different doctors, and all that when you switch locations. Okay, so it's tied to that service area. So again, that's different. Advantage plans Advantage plans are tied to a service area. Supplemental plans are the same coverage anywhere in the country. Supplemental plans are written for life. Advantage plans are written for 1 calendar year. And then that brings us to the 7th difference, and that is this: switching plans. Switching plans. Again, there are differences. All right, so here's what you need to know. When we first start Medicare, we're first eligible for Medicare. Here's what happens. Well, let's say that we're going to start Medicare July 1 of 2022. Okay, I know that's already passed, but let's say that was our time. Actually, 6 months before I start Medicare and 6 months after I start Medicare, I can have any supplemental plan of my choice. And during this time, there is no underwriting allowed whatsoever. The insurance company cannot ask you any health questions, any pre-existing conditions you have, they have to take. And so we're saying I start my Medicare in July, I can apply for the policy 6 months before, upwards to 6 months after, and during this year window, there's no underwriting required whatsoever. Insurance companies will absolutely write the policy. We call that your guaranteed issue right, okay? And by the way, this is the way it works in about 40 of 50 states. 10 of the states have a little bit more leniency on this, not a lot, but some. But the whole point is during this period of time, there's no underwriting. Now, if I'm over that 6-month window and I'm on a supplemental plan, and I want to switch to another supplemental plan, what it will be required is underwriting. I'm going to have to go through that underwriting process, okay? So when I move sup to sup after the 6 months, I want to switch companies, or I want to switch letters. I want to move from a G to an N or an N to a G. Now I have to medically qualify. 25 or 30 health questions. We're going to check your medications, get a statement from your doctor. And now that supplemental company does have the right to deny you. They can say, no, we're not happy with that pre-existing condition. We don't like that health condition, and they could deny that. Then you would have to stay on your original supplemental plan. Now, if you're medically qualified and you're healthy enough to do so, then you can get a new plan. All right, so that's switching of those plans. Now, let's talk about Advantage plans. So here's the way this works. If I'm on an Advantage plan, what happens? If I want to switch an Advantage plan to an Advantage plan, again, I can do that with no underwriting required. Okay, we just call it no you. Advantage to Advantage, I can do that. Now, I can't do that just any time I want. I've got to do that either October 15th through December 7th with an effective date on the new policy, January 1, or we can make that switch during the first quarter of the year. So if I'm on an Advantage plan in January 1, during the month of January, I can switch plans, and my new plan starts February. I can make the switch in February for an effective date of March, make the switch in March for an effective date of April. So the first quarter of every year, if I'm on an Advantage plan, I can make one switch during that first quarter. That's Advantage to Advantage. And again, we have no underwriting required. If it's in your service area, you can enroll in that plan. Now, if I am on a supplemental plan and I want to go to an Advantage plan, the way that works is I have to make that move October 15th to December 7th. So it's the only time I can do that. So I'd be on my supplemental plan until the end of the year. I make the switch at the latter part of the year, and then my Advantage plan would go effective January 1st. Okay, now, but let's suppose I'm on an Advantage plan and I would like to move to a supplemental plan. Now, this varies state to state, but as a general rule, if you've been on an Advantage plan a year or longer, what happens is now we got to go through underwriting. A lot of people think because Medicare has this open enrollment period, they can just move and switch and do what they want as though there's no rules. That's not true. If you're on that Advantage plan and you want to move to that supplemental plan, now we're going to have to ask you 25 or 30 health questions. We're going to check your medications, all that you're taking now and have in the last 24 months, and again, get a statement from your doctor. So there are health conditions that could keep you from making that switch, and you'd have to stay on your Advantage plan sometimes for the rest of your life. And so that supplemental company could deny you coverage. And I can assure you, it's not always just life and death issues. Certainly, serious health issues, life and death issues, you're not going to get the switch. But small things, sometimes rheumatoid arthritis, a company will not accept you. Someone that has spinal stenosis or maybe AFib in their medical records, or maybe they're an insulin-dependent diabetic and they take too much insulin, or they've had a complication, neuropathy or retinopathy. And so there's conditions that can keep you from actually making the switch. Medications that you're taking, sometimes they will not let you make that switch either. They're just uncomfortable with the medical condition that's underlying that would cause you to take the medication. So again, medical conditions and prescriptions that we take, and you may not get to make that switch. So again, there's rules for switching these plans, and that would be the seventh difference that you need to be aware of.